Well, hey, everybody, this is Robert, and welcome to today's podcast. Now, in early March, the Israel Ministry of Health reported on a circulating vaccine-derived poliovirus type 3 case in an unvaccinated child in the Jerusalem area. Now, since then, a number of additional cases have been reported, many asymptomatic. And the health ministry said recently that they are in the, quote, throes of an outbreak, close quote. So joining me today to look at the outbreak that's going on in Israel is a friend of the show, Stephen A. Berger, MD. Dr. Berger is the co-founder of GIDEON Informatics, that's Global Infectious Diseases and Epidemiology Network, and he is speaking with me from Israel today. Dr. Berger, welcome back to the show.
It's nice to be back. Thank you.
Well, let's go ahead and I want to start out with this. How surprised are you that there's a polio outbreak in Israel, especially since the last case was 1988?
It's a surprise, but not actually a bad surprise. I'll tell you what I mean by that. When you get to a point, because I've seen a lot of polio, in my training and what have you, when you get to a point where you become surprised by a case of polio, that's very good news. Mm-hmm. In this country, we were up to 1,600 cases a year back in the 50s when the Americans went through a similar huge outbreak. And of course, nobody was surprised. And of course, that was bad. So I'm happy to be surprised. Yes, I am surprised. We have the occasional case. It's not, quote, the real polio. It's a vaccine, as you said. It's a vaccine-derived strain of polio. That, in a way, is sort of good. I'll get into that maybe later.
Yeah.
But never boring. Yeah.
Yeah, never boring. How's the public reacting to this outbreak?
Not at all. You happen to get me in a good week for that. This is Israel, and we have Israel Passover. We have Easter Passover and Ramadan going on as you speak with a lot of instability. Yeah. So believe it, this is the first week in recent time where I can turn on the television and not even hear about Ukraine, let alone the polio. People like us do speak about it. People like us, meaning the professional people, of course. We know about it. The reaction is somewhat exaggerated, if you know what I mean. The initial reaction, it was a case we expected. It's an unusual case. We can get into that also a little later. It's not the usual kind of vaccine-derived polio.
Sure.
But bottom line, it's out there. We know about it.
Right. Yeah. Well, the health ministry says they're in the throes of an outbreak. Dr. Berger, to the best of your knowledge, how many cases have been detected to date?
One.
Okay.
I said that purposely that way. It's I didn't even know how to say throes in Hebrew. I'd have to look that one up. I don't know what that means. We don't speak, of course, doctors don't speak about the throes of an outbreak. As of the last information I do have, there's been one case. It was a 4-year-old girl in Jerusalem. It is the vaccine-derived type of polio, but a very rare strain. There have been 6 other isolates of the same strain, all of them non-vaccinated people. That's important. And this little girl was also non-vaccinated. There's something to be said about that as well. 3 of the people who acquired, when I say 6 more, it's because we went out and looked for them. It's not that they came in and said, I have polio. But as you start, of course, it's something you have to do when you have outbreaks of this sort. When you go out and do case finding, as we call it, you find people. You look in her community and people who know her and family, what have you. And so we found the cases actively. They didn't come in saying, I'm sick. 3 of the cases were said to be symptomatic, but nobody has said what that means. It could be they're symptomatic. Again, we're in the middle of a corona outbreak, among other things. So I don't know what that means. To answer your question, 1 bona fide proven case.
So when you say that, you mean actual acute paralysis?
Paralysis.
Yeah. Okay. Yeah. So all the other ones are asymptomatic.
So far, yeah.
Yeah. So are they all being found in the same area? Are they all in the Jerusalem area? Or are they spread out throughout the country?
Yes, and that should be qualified too. They've all been found in the Jerusalem area and in a specific sector. It's the ultra-Orthodox Jews, as we call them. It's a sector that's had this kind of problem with other diseases. You may remember not that long ago a very large measles outbreak among the same population in the same place for the same reason, that they weren't vaccinated. These are the vaccination rate in that population. Hard to find good figures, but it's about 50%. And that's a roundabout figure for vaccinations in general. Specifically for polio, I assume it's the same. I have to make an assumption it's the same. The virus itself has been found elsewhere, but not in people. It's been found in sewerage. That's not a surprise. And in fact, it may be the source ultimately of where these people got sick. And if you want, I can get into that now. But when someone acquires polio of any type, not just the vaccine type, it's excreted in the intestine. It's what's called an enterovirus, meaning it's inside, it's in the intestine. So that's no surprise. It goes out into the sewerage, gets into water sources, and like many diseases, is picked up from there. For indirect reasons, people don't wash their hands. We never know for a specific case. And I'm mentioning all of this because the virus, albeit has been found in 6 people, has been found in sewerage samples outside of Jerusalem as well. Not that far away for most of them. It's areas near Jerusalem. The furthest culture I saw, the furthest positive specimen I saw was in Tiberias. It's on the Sea of Galilee. It's not that close to Jerusalem. It's north west of Jerusalem. But again, the Sea of Galilee is the source for water in our country. You may not know that. The water comes from there, so that itself is a red flag.
So, other than the ultra-Orthodox populations, Israel is a pretty highly vaccinated country, right?
Very highly, yeah.
Yeah. So
polio vaccine is the rates are up around 98, 99%. This is world WHO data, which are very conservative. They estimate the true, because people may have different takes on how many they actually vaccinate, but that is the official one. It's 98%, 99% for all of them, also for measles and other vaccines.
Yeah,
but
yeah.
not the ultra Orthodox community.
Yeah, I think we have the same issue here in the States with different outbreaks amongst the ultra Orthodox, like in the different areas of New York City, because of lack of vaccination, and we've seen that with measles in the past several years, I believe.
I remember that.
Text my memory a little bit. So you kind of touched on this, but does the ministry have any idea what the origin of the virus is?
No, and that's the key question here. I'll tell you why. And I haven't seen the ministry actually bring this point up. What bothers me is having said that this is a virus that comes from oral vaccine, the Sabin vaccine, the oral vaccine.
Right.
We don't use that in this country. So where did it come from? And people are not actually asking that specific question. If it's not in the vaccine that we use in Israel, how did it get out there into the water of Israel? And it has to be, we haven't used the Sabin vaccine since about 1995. Many countries have abandoned it. So having said that, how did it get into that specific water supply in Jerusalem? We assume Jerusalem. The answer is obviously from another country. This is a country, Israel is a huge number of people coming in and out, tourists and what have you, going on right now. It's a big tourist season as we speak. The Palestinian Authority, which is in the area for, as you know, they use the oral vaccine as well. See, Israel only uses the injectable. The Palestinian Authority uses the oral vaccine and the injectable. Could be from there because they're in the part of the local population. But then again, you have the countries surrounding us. So I have to say, Kev, I don't know that they can specifically pinpoint which country molecularly, genetically, if they went in a lab and looked. I don't know if they can do that. But it's clearly from another place. I suspect we're not the only country where this happens, by the way.
Yeah. Well, it's interesting because when I look at, Africa, for example, has a lot of circulating vaccine-derived poliovirus, but most of it's either 1 or 2. Yeah. Israel's seeing 3. I mean, does that mean anything to you?
The numbers, no. It's again.
The fact that it's a different strain than
the different strain means a lot. That's right. No way to explain it, but I don't remember. I don't work with polio specifically anymore, so I haven't seen it. But I do not recall a case of circulating type 3. causing this. I'd have to go back, look in the literature.
Yeah.
That's a mystery. But having said that, I don't think it makes it more dangerous that it's genetically engineered or somehow different from the others. Because the bottom line for everything we say will be that if you're vaccinated, then none of this is relevant. A person who's been vaccinated is not going to get any of the types, no matter what else you can say in the discussion. It just doesn't happen. So it used to be, by the way, I'm sorry to interrupt you, Robert, but it used to be that when the Sabin vaccine first came out, which is in the 50s, the oral vaccine, the fact that it spreads from one person to another was considered the greatest thing in the world. I don't know if you remember that. That was a plus. The fact that someone gets the vaccine and then spreads it on to other people, we said, whoa, because the child, let's say, who gets the vaccine is going to give it to his brothers and sisters, his schoolmates, and everybody around him, and they're going to get vaccinated. And it did work. It worked extremely well. But this is before they had this alternate way of spreading through the sewage and water, which means that the virus has changed somewhat. If it's person to person, it's not that dangerous. It can happen. You can get polio from Sabin, saying nothing else about it, extremely rare. But this idea that it goes into water, changes into a more virulent strain, and then comes back and bites us, that's sort of new. So now it's not such a good thing that you can get it orally. It used to be a good thing.
Dr. Berger, let me ask you to try to just illustrate or define for the audience, because there's some confusion about the difference between a circulating vaccine-derived poliovirus and what you know is the wild poliovirus.
Yeah.
Are there any significant differences pathology-wise? Anything like that?
There are differences. There are a few differences. For one thing, having said poliovirus, we really think you're talking about three different viruses. We've been talking around type 1, type 2, type 3. So type 3 is the least virulent, in other words, the least likely to cause disease, as it turns out. The chance of getting sick from type 1 is at least 5 times higher than the chance of getting, I'm talking about the wild virus, than type, but it may have something to do with what we're saying now. The type 3, not only is it less virulent, but it's even the strain from water is less virulent. To answer your question, there were really three. It's not just the wild type and the vaccine type. The wild type was altered way back in the 50s by Sabin and Salk to a non-virulent. In the case of Salk, it's a dead virus, but it's a non-virulent virus. And that led to someone else actually getting the Nobel Prize. Just the fact that he could grow the virus and he could do these magic things. So you wind up with a situation where you have the virulent, the one that's going to give you polio, which, by the way, even that one wasn't that bad. The number of people who actually get paralyzed from the wild sounds terrible, it's going to kill you. But the people actually got polio from the wild virus is very, very small. It was the ones people that came in paralyzed with polio were really the tip of the iceberg. Most people who got wild virus got nothing, or a mild tummy ache, and that would be it. So even that was not that virulent. But of course, when you get it, it's a terrible thing. Sure. So you have the wild virus, the vaccine virus, the Sabin in this case, the live one, which is very, very rarely going to get you sick. And the statistic there is about 1 in 3 million in the old days wouldn't get you sick. That's significant now because 3 million is a lot of people getting a vaccine and not so many people around with wild disease. And the third kind is what we're actually talking about. It's the Sabin, that was the second one, right? Which gets into the sewerage and goes through another genetic alteration. And I haven't seen what that actually means, but I'm not a molecular geneticist. But that's the one that's coming to infect us now. So it's the less severe one, the Sabin, going in water and coming back and to be a bit more, if you will, virulent and giving this little girl her paralysis. I don't know what in the environment causes that. I don't know if anybody really does know, but I haven't seen literature on that.
Yeah.
But here we are.
Well, I had somebody from Israel comment on my Twitter page because I do cover, the polio outbreak in Israel, and they showed some concern that this particular strain may possess some degree of immune escape. Is there any credence to that fear?
No. I said no like that. It's just First of all, it hasn't happened with polio, in the list, so it would be just this one strain in Jerusalem suddenly. There are a lot of miracles in Jerusalem, but I don't think this is one of them.
Okay, good. Well, that's good news.
Yeah, that's good.
Yeah.
No, I don't think, because having said that, we have this case. I go back. Everybody who got it were non-immunized, so it's not a factor. It's not a point it's infecting people with. If it does infect people with immunity, we're in big trouble, by the way. And I would agree with your colleague. Polio, if I can interject something else that's not known, polio is one of the best vaccines from the standpoint we just mentioned. If you've been vaccinated against polio, you can't get polio. That's hard to say about it. You can't say that about corona, right? It's just that's a statement you can't say for many diseases.
Right.
There's a book by Stanley Plotkin. It's I don't know if you've heard that one. It's not a household word, but Plotkin is the book for guys like us. It's in its 8th edition, I think, and he says very bluntly. He says, if you've been vaccinated against polio, you ain't gonna. He doesn't use the word ain't, but you ain't gonna get polio. What he goes on to say is, if someone's been vaccinated for polio, you don't even need a booster. Now, boosters in polio is not a big item, but I see a lot of colleagues, it's their fault, they're just rules. For travelers who go to India, let's say, where there used to be a lot of polio, and say, well, you got to get a booster because they have polio. Well, it turns out that you don't need a booster. If you've been vaccinated, you're immune for the rest of your life. There were 1 or 2 case reports of people who were vaccinated. And again, we're saying it's corona, right? It's deja vu. Oh, I got the vaccine, but now I'm sick. And the question on those people was, if you look up the actual article, was it a country where you could sort of, was the vaccine really in the refrigerator? Was it used correctly? There were those questions that, let's say, get asked, and they're not always in the best journals or what have you. So I am convinced that if you're vaccinated, you're not going to get it.
Good.
And now the type 3 is against everything you just said. What you just asked is against everything I've just said. So I'll be very upset. I just don't want to think about it. That there is actually vaccine resistance in a new polio strain.
Now, from your vantage point, Dr. Berger, what's the public health response going on in Israel right now? Is it just vaccination drives? And
as far as I can see, yeah, but no, also case finding and what we talked about, and going on testing more. There's a lot of environmental testing. I don't have any numbers beyond the ones I gave you. That I said it was in the Sea of Galilee, and I just don't have the figures. But I'm sure they're very good at that. I mean, they're very good at that.
Yeah.
Vaccinating, vaccine drives, of course. I'm sorry to cut you.
No, go ahead,
vaccine drive for the ultra Orthodox people, which is, they were up over, I think, 30,000 people specifically vaccinated in that community a few days ago. I don't know the number for today. So it's pretty good.
Yeah. Let me step away from Israel for a moment and just talk about what's going on in Africa with the vaccine-derived polioviruses. And they're just reporting hundreds of cases on the continent past several years now. What's the answer to that? Is it because they have just such poor vaccination rates there that, I mean, that's got to be the answer, right?
Yeah, I would think so. It's yes and no. There's a lot involved, and not just that they are developing countries and they don't have the means or what have you. There are some very interesting, actually, political and religious overtones to what happened in some countries. So Nigeria is a good example, which I can tell you, where vaccination is not done. One interesting exception to what we've been talking about is the latest case of type 1 polio in Africa was in Malawi. And Malawi has one of the highest vaccine percentages in Africa. They're doing very well with vaccine. Again, this is the WHO figure. They say it's up over 90%, which is like the Israeli number. It's over 90%. So I'm not sure what that one means. Again, you could hypothesize that perhaps they are vaccinating for one strain and they're getting the other strain and this sort of thing. But the bottom line for Africa is the average vaccine uptake for Africa, all vaccines together, if you put them all together, and for polio, is about 60-65%, which is terrible. Lots of vaccines, you have to be over 90%. For measles, you have to be over 95% probably. 60 clearly is not good. So I would say for most cases, it's poor vaccination. having said that, again, you remember the paradox I brought up before. If there's poor vaccination, then where is their vaccine-derived polio coming from? If there aren't people who've been vaccinated to put it in, then to go on and put it in the sewage, where's it coming from? And I'm sure that they have explanations for, good explanations for any specific case. A lot of politics that are kind of interesting. I don't know if you want to get into that, but Afghanistan and Pakistan, you may have noticed, have most of the wild polio. Why those two countries? You know about that? I don't know if you
yeah. But I mean, last year they did really, really well.
Yeah.
Yeah.
But they still have the cases, and they're having the vaccine-derived ones. So Afghanistan, of course, you can't criticize for anything. Who knows what's going on there? Quote, quote. It turned out that in Nigeria, which had a huge number of cases a year ago, Nigeria in recent years was telling people, the politics are just sort of interesting, but Nigeria in recent years was telling people not to take the vaccine. The reason being that the vaccine in northern Nigeria and some of the Muslim communities, which is in the north, they were saying the vaccines are instruments of the West to sterilize Nigerians. It was also, then they were saying it's haram. It means it's forbidden by Islam. They were telling them that too. And that still goes on now in Afghanistan and Pakistan. Now, why those two countries? And again, I just love the stories, so you'll forgive me for this. And the person you can blame for that is Osama bin Laden, believe it or not. You know that story? And it's true. You can look it up. They have murdered in Afghanistan and Pakistan in recent years, up until a week or two ago. They murder healthcare workers who come in an attempt to vaccinate their people. They murder them. Among other things, for the reason I gave, and again, there's a story with Osama. I would ask you to look it up. So that's not the explanation, but certainly a good part of the explanation why those countries. So it's not always just not vaccinated. There's something behind it. Yeah.
Well, I guess, I mean, I'm an optimist. I remember about 10 years ago, India reported their last wild polio virus case. I think it was in 2011. And it wasn't but a few years before that, they were reporting, hundreds of thousands annually. So, I mean, so it's all possible, right? I never thought in my lifetime I'd see India eradicate polio.
I never thought of smallpox, same story, India eradicated. And they paid people, that they paid people to bring the cases in. There's a lot of stories with that. If you see a case, bring it in, we'll give you $100, whatever it was. And they believe me, they were bringing in chicken pox, anybody with a pimple, just bring them in. They were beating them up. There were stories about it, just to get them out and bring them through. But they eradicated it. It worked. Yeah.
Well, Dr. Berger, let me go ahead and close out with this, get away from polio for a minute. What's the latest work you're doing with GIDEON Informatics? I know you guys are always putting out new stuff.
Yeah, we're putting new stuff on a daily basis. It's gotten very exciting. GIDEON is following every disease and in every country in real time. And that's gotten difficult for an obvious reason named Corona. So I'm the Corona. I have to go through, it's just fallen on me for many reasons. And the literature is, believe me, overwhelming. But we're putting in all the case reports and anything that's out there, we're putting in it. Having said that, we've taken on a lot of people. We have new designers, very exciting people, new programmers. I took in 3 MDs, people who do what I do. They do the editing and the updating and what have you. We have a book about polio, by the way, that I may have mentioned. It's the most up-to-date and comprehensive book on polio, as are all our other books, because they all came out in February. Our books are all updated every year. There's a Corona book, which is part of what I talked about before, like I'm in the book. It's a 900-page book. And I don't know that there's been another coronavirus book in the world. There are books certainly about vaccines in Corona and conspiracy theories and politics and that kind of stuff. But I don't know if there's a book that covers the disease itself, epidemiology. That one has about 1,300 graphs in it, and it's 900 pages. And it's exciting to do this stuff. And it's updated again automatically by the database. So as I said before, never boring.
Yeah. And I want to encourage viewers and listeners, if you want to check out more, go to GIDEONonline.com. And I'll go ahead and link to that when I publish the podcast. And I want to thank you, Dr. Stephen Berger, for joining me once again and giving us some insights on what's going on with polio in Israel.
My pleasure. Thank you so much.
Appreciate it, sir.